All right, guys. So in this video, we're going to be talking about evaluating different Medicare Advantage plans, the different things you want to highlight when talking to a client and the biggest pain points for most people, and just how to explain and understand these programs. So I'm going to share my screen here. Let's go back to the Humana Gold Plus plan we were looking at before. This plan is an HMO. So you remember an HMO is a limited network of providers. And so with this specific plan, they're going to get more benefits because they have a lesser network of providers. They have less options. So they try and sweeten the deal by giving more benefits. So what do those look like? Well, first of all, the plan premium is $0 a month. That's awesome. And then when we look at the medical deductible, it's $0. So the plan kicks in right away. The maximum out of pocket for the year is $2,500. So the maximum out of pocket is just like it sounds. It's the maximum amount the client will pay in co-pays before they don't have to pay anything else. So in this specific plan, if they go to their regular primary care doctor, it's $0 for a visit. If they go to a specialist, so anything for the lungs, heart, cardiologist, gynecologist, any of those ologists, right? You're going to be paying a $15 copay per visit, which is really good for a lot of these plans. Then you have inpatient hospital care. So if they go to the hospital for days 1 through 7 with this specific plan, they are going to be paying $150 per day. That is pretty typical with Medicare Advantage plans. They typically have a certain amount that the client's going to pay per day for the first anywhere from 5 to 10 days being in the hospital. After that, it kicks in 100%. They pay $0 for days 8 through 90. Skilled nursing facilities. This is if they have a stroke or something like that, and they need additional care where they still should be in a hospital, but the hospital kind of wants them out. They'll go to a skilled nursing facility where skilled nurses will then take care of them. And it's kind of like a hospital, but without the doctors. And so with skilled nursing facilities, it is a $20 copay for days 1 through 20, and then $196 after that. Home health care, $0 copay per visit. That's great. But the biggest ones people care about is if they go to the hospital, if they need to see doctors or a specialist. Another thing people will care about is services like surgery. So in-network outpatient surgery, that just means any surgery, a knee surgery or anything at all where they're going to be outpatient and where they go and get that surgery. The maximum copay they'll have to pay is $150. They go to the emergency room, it's $90. If they need diabetic supplies, it's a $0 copay. And then ambulance services, $220 if they need to take an ambulance trip. Here's the over-the-counter benefits. So every 3 months, they get $150. Chiropractic, they don't really talk about too much. If your client, it matters to them, you can highlight that. And then it gives eyewear and hearing aids, and then a fitness benefit. So some of these plans, they will not show the actual, like this plan, it doesn't show the dental benefit here. You're going to have to go down into the summary of benefits. Again, when you scroll all the way down and go to the summary of benefits here. If we keep going, after that, highlighting the fitness benefit where they just get a free gym membership through Silver Sneakers, it is going to cover the pharmacies. So this is the prescription drug part of this MAPD plan. So the initial coverage limit that is pertaining to the donut hole, we'll talk about that in a different video. But you can see here the tiers of drugs for most preferred generic and generic drugs. They are going to have a $0 copay. The majority of prescriptions people are going to be taking are preferred and preferred generic drugs. So amlodipine, metoprolol, all of those basic drugs we see all the time, they're preferred and preferred generics. And in this plan, they would have a $0 copay for those plans. And if they do a 3-month supply, sometimes this 3-month supply mail order is going to be a different cost than the cost up here. But that is basically, it's pretty cut and dry. If they need higher tiered drugs, more expensive prescriptions, preferred brand drugs, they're going to be paying a $47 copay, and not preferred drugs are going to be a $100 copay. And then specialty tier is going to be $33 50% of the cost of the drug. And so that is what the costs or all of the benefits are with these specific plans. And really, when you're walking through this with a client, you want to highlight with them, if we just think logically, what are going to be the things that cause them to hit the $2,500 total limit? The things that are going to cause them to hit it is not going to a specialist. That's $15 a pop. It's not a one-time surgery. No, it's going to be multiple hospital visits, right? Because if you take $150 times 7 days in the hospital, well, that's $1,000. Well, if they do that 2 times in a year, now they're at $2,100 of their total maximum $2,500. Well, let's say they take an ambulance each time. So $2,100 plus 220 plus 220. Now they've hit their maximum out of pocket. So the ambulance trips, the higher co-paid items of surgery, things like that, those are going to cause people to hit their maximum out of pocket. But really, I think the statistic is maybe 5% of Medicare recipients hit their maximum out of pocket every year. It's a very low percentage, and you'd have to be in really not good health to be hitting that maximum out of pocket. There's ways to cover these copays, and that's a product called hospital indemnity coverage that we're going to cover in a later video. But that is the basic walkthrough of Medicare Advantage plans. So in the next video, I'm going to show you guys how to compare plans and also how to enter in prescriptions and doctors. And so I will see you in the next one.